Folks, we have 60 minutes for questions.
So interesting.
Oh, there you go.
Hi, folks. Thanks so much for that. I'll start the questions off. I guess you talked a little bit about knowledge translation and how this is like one of the steps or things that folks are doing. And I'm just curious a little bit around some of your thoughts on how to share this back to the broader community in ways. And I know you talked a little bit about the new intervention money you guys got, Jeff, but just curious if you guys want to talk a little bit more about that.
About the specific project or about other sort of ways that we can think about doing knowledge translation?
I guess you can talk about whatever you want to, but I was curious just around this project as well. But yeah.
What do you guys think for knowledge translation?
Do you want me to answer that one?
I want you to answer it.
Sure. So doing this particular research, when it came down to analyzing the patient-doctor relationship, they really perceived them to have limited queer competencies, and because they didn't know what PrEP was, and when we looked at the Center for Excellence's website, they had this really neat toolkit that had a lot of the forms that you needed to bring your doctors to inform them what PrEP was about, any sort of other information when it came down to testing and other things like that. So I'm not sure if it was just something that was well marketed or whatever it was, but the language just wasn't very easy to understand, nor was it very engaging as a process for people to have to go and sift through a website and then have to print down and something like that. So I think being able to create a toolkit that you can just click on, print, and then be able to bring that to your doctor, I think is somewhat of an interactive way to go about doing it. And I'm such an advocate for patients who need to do their own research and really be able to ask what they want to their doctors.
Yeah.
Mm-hmm. Anyone?
Any other thoughts about knowledge translation? Cool. Thanks, guys.
You guys were just alluding to your sample size and not quite hitting your targets, but I'm just curious what the goal for the sample size is and where you're currently at, if you're able to share. And then I have one other question after that.
So we ended up having eight guys in our sample. Oh. 8 guys in our sample, and I think we were aiming for a target of 15 to 20 in that range. And so we have some more data collection to come, and we'll also be working with Nate and his sample, and so we're confident that we'll get up to our sample size that we were looking for.
Great. And then you alluded earlier in the presentation about the use of the HERE and the impact on the clinical encounter, but I didn't quite catch the finding unless I somehow missed it.
Yeah. So that's good because we didn't actually pull out a lot of the quotes around that. But one of the findings that we have found has been that these conversations around, sexual behaviors and especially drug use are new for the doctor and the patient. And so the guys were commenting on the fact that sometimes they didn't feel comfortable bringing up their drug use to their doctor, but the fact that it was sort of prompted by this very standard questionnaire elicited a conversation that they found valuable. That being said, most of the guys felt like the process was very much a quick yes, no checkbox, and the doctors, for whatever reason, I think this is part of knowledge translation, they might not be comfortable having those in-depth conversations, but it didn't really go beyond, is this a risk factor for you, X, Y, and not taking into account someone's drug use and sort of their holistic health beyond maybe the one interaction where they're attempting to be prescribed PrEP. So I think for me and a lot of the folks in our group, it's how can we leverage the HERE scale as not just a tool to sort of check some boxes in order to go through the process, but to have genuine conversations that can influence care across a person's entire life and not just that one interaction. We do have some results that have to do with that, but again, it's very preliminary, and most of the guys said that doctors were kind of checking the boxes.
Yeah, and I guess I would also just be curious to take it one step further to understand if there's any differences for clients that are doing the HERE at HIM versus a private GP office, because I think that would just out of curiosity, it'd be interesting to see if there's a difference. I'm looking at my colleagues who work at the HIM Health Clinic, but just seeing if there's a difference in the experience, whether it's at a private GP practice compared to coming to the HIM Health Center, where they're already answering some of those sensitive questions with perhaps a regular STI screen.
Mm-hmm. Thank you.
Hello, thank you for your work. I was wondering a thing about the more condom-less sexual behavior, like if it's more something of a perception than actual, because I mean those guys are on PrEP because they score on HERE like having some condom-less sexual intercourse before being on PrEP. I wonder if it's more like a choice of having condom-less sexual activities when they are on PrEP than they were before. Like I'm just supposing that it may be something more around shame. And just a little comment on some language use. Like you say, you report that they were engaged in greater risk behavior when they are on PrEP, but I just find it a bit awkward because they are less at risk for HIV. So what are we talking about around that? So, yeah.
Just to start from the end. The greater risk behavior, that's a good question, by the way, thank you. The greater risk behavior doesn't just refer to HIV, it refers to other STIs as well. And we also use the language that the participants themselves use. So the term risk wasn't meant to be used in any sort of critical or condescending way. So I just wanted to point that out as well. As to the condom use, so we didn't particularly ask how that changed with PrEP use. Some of the participants started, for example, they were in a monogamous relationship before, and they were out of the monogamous relationship and they wanted to experiment more. And for them, once getting on PrEP, they stopped using condoms because they just didn't want to use them anymore. Other people, they continued to use condoms. Of course, the sample is very small, so there's no way we could tell how many people got off condoms or how many people continue using them. This was just sort of to point out the various ways in which PrEP use affects condom use too.
In terms of risk, one thing I'll mention is something that kept coming up in our results or analysis was the fact that a lot of guys found that there was resistance to condom use if other guys knew that they were on PrEP. So for guys who were on PrEP, they felt and wanted to use condoms, they felt like they were having to sort of defend the fact that they wanted to use this other form of protection for other STIs, and that they were, in effect, being educators about the fact that PrEP was only protecting against HIV and not other STIs which were on the rise. A lot of guys said that they had participated in a lot more sex since going on PrEP, and the fact that their rates of STI incidents personally, even within like a 1 year period, had gone up. So PrEP had only been available, I think, when we did this, probably like 6 or 7 months. And so even within that period, a lot of the guys were reporting they had STIs when they never had them before because they were having riskier sex.
All right, any more questions? We still have 5 more minutes.
Thank you for that. I just had a question about if you were at all looking at how PrEP education is done, and in the sense that are people understanding not just that, yes, it protects against HIV, but as well as it's providing, there are other side effects that are incorporated in that. Is your investigation looking at that at all? Or how physicians, for example, at him or at private clinics are delivering that information differently. Or also one more thing is, for example, PrEP has 7 days until it reaches its effective dose. Is that something that's being communicated? So those are the points.
Yeah, so when we talk to our sample, when we ask them where they got, a majority of their information regarding sexual health and how they heard about PrEP, it's mostly through word of mouth and through their friends. So, when they go up to their doctor and they say, oh, there's this new thing where I heard that you could prevent HIV with this, can I have it? There really isn't that much more to it. So when it comes to PrEP education, I do think that there needs to be more in terms of the knowledge translation piece to include all those things like you said, like side effects, waiting periods and things like that. But yeah, that's definitely something that we're looking into as well. So thank you.
And then also for me to respond to that question, I've heard feedback from guys who are doing PrEP outreach out in the interior northern region that when they were talking to other guys about PrEP, the guys who were asking questions like what are the other side effects, how long will it take to take effect. So I think for a lot of guys who are interested in PrEP, a lot of us are like really, I guess, savvy and curious enough to know like all the facts before we start delving into PrEP. So I think even if the education isn't passed on to everyone, I'm really sure that there's guys who are making sure that the community knows of all the information related to PrEP.
Okay, thank you.
Can I say one last thing? Yeah. The investigators in Vancouver are recruiting, so if you know any young queer folks who might be interested in learning some research skills and hanging out with us, we meet once a week for 2 hours a week, and we'd love to hear from you. So investigators@cbrc.net, drop us a line, plug.
There's food.
There's food. Thanks, everyone.